As John Billings said, health is like money. We don't know the value of it until we lose it. Hello all, and nice presenting you all the part 2 of the oral cancer. So in this video, we are going to see what are the ways you can find whether you have a oral cancer or not. So as I said in part 1, everyone who consumes tobacco, alcohol have frequent irritation for their soft tissues because of their sharp teeth or those dentures. Human papilloma virus are some risk factors for this oral cancer. So what to do if you get this oral cancer? Relax. Just get it treated. The main thing is early diagnosis. You have to find it very early, whether at the starting stage, and if you get it treated, you can have a better lifestyle. And it is actually advisable to prevent it and getting treated in the precancerous state only. So the because treating a oral cancer at a higher stage brings a lot of lifestyle changes, which is actually not advisable. As I said, precancerous lesion. These precancerous lesions are actually present before anyone who develops a cancer. So finding it just before a cancer or before developing a cancer and treating it will help you have a better lifestyle. So if someone finds with a precancerous lesion in their oral cavity or somewhere else, it is actually the right time you quit your habit, get into the treatments. Various treatments are there, you can get into the treatment so that you can have a better lifestyle. So how will I find this precancerous lesion? For smokeless tobacco uses like pan masala or your mavas, etc. Actually, you'll be making it as a quid, and you'll be placing somewhere in your oral cavity. First, you look into that place. If you will be finding some inflammation, digesting in higher cases, you will be seeing some melanosis and something keratin or keratosis. They will be say, and it will be appear keratinized. Okay, so these all indications of a precancerous lesion called as tobacco pouch keratosis. Nevertheless, you can see in other places of your oral cavity also. Secondly, when you just run your finger inside your inner cheek area, which is in the buccal mucosa, you can actually find a fibrous band in case of tobacco consumers, betel nut consumers, when they consume it for a longer time. These are actually a fibrous bands, okay? And if you just have a look, in some cases you can actually see a blanching of the mucosa. And the most important indication is when you put your forefinger, middle finger, and your ring finger inside your mouth like this. It will actually don't go freely inside. It will be a very restricted mouth opening, which is a classical sign for this oral submucous. Next, if you see in smokers, there will be two conditions called as leukoplakia and erythroplakia. What is this leukoplakia and erythroplakia? Is that leukoplakia will be something like a whitish patch on the inner side of your cheek. Erythroplakia is something a reddish substance on the inner side of your cheek. It will be appearing something like a very red or inflamed substance, and both are not scrapable. Okay, and this leukoplakia will have a cracked mud appearance, which is a typical of this. It will be actually seen just before your mouth commissure on the inner side of this place, mostly seen, and can be seen anywhere. And erythroplakia, it will be tend to bleed easily. The cancer from this precancerous lesion is very high, especially with erythroplakia. The chances of getting the crab is very high. So, what in case of sharp tooths and sharp dentures? This is something condition called as frictional keratosis, where, as I said, in the leukoplakia there will be actually looking like a white patch, but there won't be any cracked mud appearance. But something like some keratin layer formation, which will be whitish in color, you can actually find that very near to the sharp teeth. When your soft tissues frequently get irritated by this soft teeth, this keratination actually forms as a defense from the soft tissues. The difference for the soft tissues from the sharp tooth. So this frictional keratosis is the very important precancerous conditions related to your dentures and. Okay, now comes the question: how will this oral cancer appear? In cases, if we just have a look into oral cavity, it will be like a cauliflower-like growth. If you see, the ulcer will have an everted edge, the granulation tissues will be poor. But in many cases, what this oral cancer does is that it doesn't show up in oral cavity. It will be actually spreading within the oral tissues, creating a greater damage, very high damage. The most important is the bone. Your favorite food for this oral cancer is your jaw bones. It will just eat it up. Okay, and in extreme cases what will happen is there's something called as pathological fracture because of this erosion or whatever it is eating up of the bone by this cancer. What happens is that your jawbone tends to break. It is called as a pathological fracture. It will still further complicate the situations. It will be actually seen in the stage 3 and stage 4 of cancers, and your tooth will fall off without any reason, but what we will be suspecting is because of a gum problem, but what lies inside can be seen only via a radiograph, which is an x-ray. So whatever we see in oral cavity or whatever we see in X-ray, the most confirmatory is taking a biopsy. Only if you take a biopsy, take a excisional or incisional biopsy, mostly a combination of mostly an incisional biopsy will be taken with the normal tissue surrounding it, depending on the size of the cancer which we are going to treat. And if we just have a look in a histological way, histopathological way in a microscope, we can actually give a confirmatory diagnosis of what type of cancer is it. First of all, it is a cancer or any precancerous lesion, or it is something any other pathology due to some infections or something. So what is confirmatory here is histopathological sections which is seen under a microscope. So looking on to some facts, this leukoplakia and erythroplakia which I discussed before, this erythroplakia, if you have 91 percentage of chances are there that it will develop into a cancer, whereas this leukoplakia is somewhere around only 50%. And oral submucous fibrosis, it is a condition. So you might have oral submucous fibrosis here, but the cancer can grow anywhere else, anywhere it can develop. And the more complication is that it can metastasize. For example, you have a cancer here, it can actually spread through your chest, lungs, it can even go to some distant parts. And the main drainage for this is lymph nodes. You can actually check for your lymphs whether your level 1 to level 7 lymph nodes are inflamed, or it has any like ball like something or rounding, you can see, just telling in a layman term. Okay, so any firm consistency of your lymph nodes which can be seen, but it's actually difficult for laymen to just check whether the lymph nodes is palpable. My advice is to go to every, if you have a habit or something, or in general, what we actually say is you should visit at least once or twice in a year to a dentist. Not only oral cancer, any other pathology which can be detected can be actually treated at the early stage, which is actually bringing great difference in the lifestyle of a patient. So if you are going to go to a CATS or going to a stage 4 or stage 3, it's actually very difficult and you have a lot of changes in your lifestyle. Your face might change. What and all you see in the movie is actually true. Just before the movie they'll be putting some oral cancer videos. It is actually true, absolutely true. If you're not finding it or something, you are just don't care about it, you can actually grow outside. It will be affecting your face, you can see this. And what actually they will be doing is they have to remove all this, they'll be taking somewhere else to cover this, they'll be taking somewhere some tissues or muscles from somebody somewhere else of your body, uh, your own body, and they'll be covering it. It actually adds more difficulty for the surgeons, as well as the patient's lifestyle will absolutely change. You have radiotherapy, chemotherapy, which is going to destroy you completely. So what my advice is, diagnosing at early stage, especially in the precancerous lesion, avoid all habits, remove all habits. Okay, if you get anything happens, find it at early stage, visit your dentist frequently or any doctor frequently, find it, get it treated at the early stage, because as stage progresses it will be very difficult. So part 3 will be on prevention and another tobacco replacement therapies which I'm going to talk about. And thank you all. Be take seriously about this oral cancer. And to say, last Sunday was our 31st of May, was our oral no tobacco day, not our oral no tobacco day. So think wisely, avoid tobacco or limit the usage of tobacco so that we can all have a salubrious life. Thank you.